well. So yeah, welcome. We've got an hour and a half for this session. We may not need it. We'll see where we go. It's a very kind of informal session. We've got a couple of slides that myself and Alan will talk through. We'll do some quick introductions in a minute. We'll work through the slides, and then basically it's just opportunity for questions and checking in to where people are up to, really. So let's do some introductions, and then we'll take it from there. So Alan?
Yeah, hi Melissa, hi everyone. Alan Rimmer, Head of Operations in Liverpool Place, supporting the community division with the Lift Decamp project group.
Lovely. Thanks, Alan. And then we've also got on call, we've got Suzanne. Hi, Suzanne.
Hi everyone, I'm Suzanne Stanley. I'm the Strategic Estates Business Partner and one of the estates leads for this project.
Thank you. And then from the project team itself, we've got Ashley. Hi, Ashley.
I am Ashley SMU. I'm from the strategic programs team, and I'm a project coordinator. I'm working on this project.
Lovely. Thanks, Ashley. Did you get the slides I just sent over?
Just about. Yeah.
I just sent Ashley the slides and asked them would she share them for me. I was just checking you'd got them. Thanks, Ashley.
It's a crazy number.
Oh, I know. So we've also got on call Marg Dow. Do you want to say hello, Marg? Maybe she doesn't. Are you there, Marg?
Yeah, Margaret Dowd, RCM.
Ah, there she is. Sorry, I caught you on the hop then. And I'm just checking to see if we've got anybody else from the project team on. We are expecting someone from HR, and we usually have Chris Lyons as well. I think we might see. He may join us. I'll keep my eye on the list and introduce him if he does. So welcome everyone. Now the purpose of these sessions really has been throughout the whole of this consultation just to try and keep people up to date. We appreciate it's so hard to kind of keep people connected and make sure that people have all the information that they need. And we've been running these sessions since May to try and do that. There's such a lot of people involved in this project as well, over 1,000 people from all different teams, from different directorates. So there've been a number of these sessions, and like I said, I know some of you have managed to get onto those. So just to kind of say that for today, I'm not going to be running through all the slides and the big kind of backstory to this as a piece of work. Today, the purpose is just to do a little bit of an update, to check in with people where they're up to in terms of this consultation process, to give people an opportunity to ask any questions that haven't either been asked yet, or maybe it's a question that has been asked and it's on the frequently asked questions, but you haven't seen it, and that's okay as well. And there may be things that are occurring specifically in your team that you want to kind of raise here and now. Obviously, we've got Alan and we've got other service managers online who can attempt to answer those questions as we go. If it's something very specific and we're not able to answer it on call today, then we'll, as we've done with all the other sessions, we'll take things away and come back to you as we can. So Ashley, are you able to put the slides up and then we'll run through those? So folks, it would be helpful if you've got any questions, you can either, well, two things, you can either drop them in the chat box, and that's helpful because then we can read them and we can respond to them in order, or make a note of any questions or thoughts that are occurring, and then when we take the slides down in a minute, we can ask you for questions and you'll have them all jotted down. We'll wait until we've done the slides before we open the floor really for conversation. But I know there's quite a few of us on call, but it is very informal really. So, you know, please do feel that you can kind of put your hands up and you can have the conversation, share your thoughts, let us know how it's feeling, what's going on for you. That's what the session's about today. So I will keep my eye on the chat and Ashley's sharing the slides. So if you can move it on, Ashley. Great, thank you. So this one you will have seen before, but I'm just putting it on just to give a little bit of an update really on the bigger piece of work that's happening here. So if you haven't seen this slide before, you will notice that it started back in May when we began to have communication sessions with colleagues around the proposals in terms of base moves. And then the timeline that followed on from there was basically that from June, people started to move. So Hollins Park House is our trust headquarters that's over on the Winnick site, and that was emptied from early June so that estate works could start to make Hollins Park House beautiful and ready for new teams to move in. Now that work is underway at the moment. Hollins Park was emptied and colleagues have moved elsewhere. You'll see that those blocks up to there are in green because that's signifying that the work's underway. The formal consultation with colleagues, with all of us in scope for these proposed base moves, opened on the 22nd of June, and it will actually run through to the 12th of August. It was extended because of new teams that joined as a result of Goodless Road being impacted. So the formal consultation is open until the 12th of August. Now, following on from that, you can see running down that list then that the work continues. So the next thing to happen during July, and I think it's actually started because we had some colleagues from Puma Court with us yesterday on a call. They said it had started. That some minor works over at Puma Court. Now, Puma Court is the proposed office space for colleagues working in telehealth and SPC and single point of access services and CMO. So work in Puma Court is being done to make that to update and add a few bits and pieces, like make door frames wider and things like that for disabled access. So that work is happening at the moment. And then when we get to the 12th of August and final plans are pulled together, so consultation will close, final plans will be pulled together and will be shared. And then we'll move into implementation. So corporate teams will move out of V7 and they will move into Hollins Park, which will be ready for them. And then there'll be some minor estate works in V7, and colleagues that are moving into V7 will then do that throughout August, September and into October. And some of those teams will be from Babbage House. But since we started this project on the back of consultation and feedback that's come from teams, I know many teams that were in Babbage House are not coming to V7 now. They're going elsewhere, and Alan can talk us through that in a minute. But you can see all of this, and the timeline around this is leading us up to the closure of Babbage House at Lip at the end of the year, ready to hand back the lease in January. So I don't think there's any new information on that, folks. We've shared it a number of times, but it's just to kind of give you that update and let you know where we're up to. Thanks, Ashley. So again, just to remind people of what's been happening around this as a project. So throughout June, we've had a number of communication sessions. And as I said, some of you have been to those. Throughout June, July, we've been having weekly staff side meetings with Ian Raven and staff side colleagues. And the project team have been working on the completion and the addition to the frequently asked questions. So I looked yesterday and there were 93 questions on there. So, you know, there's absolutely loads of questions, ideas, thoughts that have been posed across the whole of this time. And, you know, we can keep adding to that. And then when we get to August, as I've said, the consultation will close and then final plans will be shared. So that's what it's looking like in terms of that time frame. Thanks, Ashley. So, Alan, do you want to pick up and talk through the specifics for these teams? Yeah,
that's fine. So people have been on the earlier calls will have seen some of these slides. They're not new, so I won't go over them in any major detail. But when we first started looking at this, we identified from the community division of staff based in Babbage House, there was around about, give or take a few, 520 odd staff that we needed to consider how we're going to move them from Babbage to the next appropriate location. We felt the best way of doing this was to group staff up into 3 tranches. The first tranche was in the easier to do box, and these were groups of staff, groups of services that were predominantly non-patient facing or managerial type roles or governance type roles, where we felt that a move to V7 in the main for those services wouldn't be too disruptive. There might be individuals within those services that through their one-to-ones expressed some challenges with that move. But in the main, these services could move to V7 without too many difficulties. And at this point during the consultation, that remains the direction for those services. Just go on to the next slide for me, please, Ashley. Next slide being tranche 2, with patient-facing services that either covered a bigger geographical caseload than just Liverpool. So being based somewhere like V7 could in many ways act as an advantage to them because they were closer to some of their patient caseloads. Or they had the option of having alternative bases within Liverpool, such as GP surgeries, treatment rooms, other areas where they could base themselves out of during the day. So this was tranche 2, slightly harder to do box, more conversations to be had with service leads to test some of our assumptions. But in the main, the majority of these are also going to V7, and I'll touch on some of the ones that aren't in a moment. And then the next one, please, Ashley. So tranche 3, this was in the much harder to do box. So services where they had their caseload predominantly in Liverpool, which we felt that moving services and staff away from the Liverpool area could impact on service delivery, potentially lead to patient harm. And we expected a significant challenge from both from clinical and managerial staff, but also from staff side, potentially from the public and further afield, if we were to move these services out of Liverpool. So we started working relatively early with service leads to look for potential alternatives to V7, and some of those options are listed down the right-hand side there. So if we go to the final bit for me, this demonstrates our best proposal of what we're going to do with the majority of those tranche 2 and tranche 3 services. Some of them are missing off this slide, I just noticed, so I'll talk to them as well. So when we met with palliative care on one of the previous engagement sessions, we were actually trying to find alternative locations for them within Liverpool, but the team commented back that a move to V7 would actually work in their favour for the reason I mentioned earlier. They cover different geographical areas within their caseload. So a move to V7 was supported in that respect, and the desks will be found in V7 for that team. And then I think there's some other conversations going on which maybe sit outside of this consultation with the palliative care service that sits up in the Liverpool and Town Hall, potentially the opportunity that V7 creates to bring those two teams together. So sits slightly outside, but V7 creates a positive opportunity there, we hope. The next one was ICRAS, probably our biggest challenge given the size of this team and the fact that this team have predominantly not worked in a hybrid, agile way over the pandemic. So they've worked very much together in one base. So this was always going to be difficult because we knew we couldn't find a base within Liverpool to accommodate everyone. So there was going to be challenges and barriers that we had to face either way. So we've settled with the management team there to move them across 3 sites, V7, Old Swan and Goodless Road, and the management team are helping to try and place certain functions of the team in each of those locations where it makes the most sense. And that's what will happen through your conversations with your one-to-ones. You can help influence where those teams need to be, but they're ultimately the bases that we are looking to move ICRAS teams to. In order to create some capacity in those new bases, we've obviously had to ask other colleagues to become part of the consultation and move. So at V7, ICT staff will need to be moved in some ways, but we can find some accommodation for them in V7 and the Dovecot, and the nurse admin team down at Goodless Road. And the phlebotomy admin team at Goodless Road, we're asking for some changes around their working practices as well. So to move to V7 or to move to Puma Course as part of the SPC telehealth function when it comes to the phlebotomy admin team. In terms of therapies, so we're talking COT art and community physio, or community OT and physio teams. They were destined for V7. We're still going to send or have some desks within the V7 building about 20 desks, but we felt that it was vitally important to have Liverpool bases as well. So we've managed to get some protected hot desks down at Lifehouse and some more protected hot desks within Livingston Drive as well. And we're looking to build the appropriate storage facilities within those buildings as well to protect your services when you're working in and around Liverpool. Community admin at Babbage House is still destined for V7. Nicola Ashley is on the call, so you might like to comment on that a bit later on. I think we're looking at creating something different around our admin resource within the division. Telehealth and single point of access, single point of contact, still destined to move to Puma Court, but they're now going to be joined by their colleagues in CMO, who are going to be moving from Queen's Drive to Puma Court to be part of that team. And in doing that, that creates some space for our bladder and bowel team to move from Babbage House up into Queen's Drive as well. And I should say, also to create some space within Puma Court, the Mid-Mersey teams will be moving into V7 as well. So Puma Court will become this telehealth digital type hub for the division. The teams that we've not put on this are the skin team. In the last engagement session, we had a member of the skin team raised a few issues, a few concerns that they had in regards to moving to V7, where they were going to sit alongside the lymphedema team. And we've since been able to have some conversations to find space at Dovecot. So that will be consulted on, and we'll hear people's views on that via their one-to-ones. And then the other teams that were picked up in the last engagement session were the practice nurse development team, who we agreed were moving to V7, and the IV team, and we confirmed that they would also move to V7 as well. I think that's me, Melissa.
Thanks, Alan. So I'm going to move us on, but I'm imagining that most of your questions are going to relate to the information that Alan shared. So last couple of slides, and then we'll take them down, and then they'll have the opportunity for questions. And I can see colleagues have started to put them in the chat, so that is helpful. Thank you. So just to reiterate the process around the consultation and what we're asking managers to do. So all colleagues that are in scope for these proposals are being offered a one-to-one conversation or one-to-one meeting, and line managers are being asked to keep a record of the meeting on a one-to-one template to capture everybody's views and you know, their thoughts, whether they're happy with the changes, whether it's causing them problems, difficulties, whatever. Colleagues can ask for HR support or staff side support in those one-to-one meetings if they so wish. And just a point that if you do want staff side support, that's for you to organise yourselves. So just to kind of mention that. But this purple table on the slide that I'm showing covers off the 4 steps that we're asking managers to go through. So the first step is a one-to-one template, which is for people to complete with the personal details, and then to list any individual arrangements that they have in place, any flexible arrangements or any equipment or reasonable adjustments that they have, and then also an opportunity to say what your preference is around where your base would be. And those documents we're asking team managers, team leaders to send through to the appropriate HR team. So in recognition that they could have personal sensitive information on them. So they're to go through to HR. And on the very front of the one-to-one form, there's a question that is, I can't remember the exact wording, but it's basically, are there any issues on here that HR need to kind of connect with you around? And it's either a yes or a no. So for instance, my teams, when I did their one-to-ones, nobody had any like outstanding issues, so I just put no on those. And when they land in the HR box, the relevant HR team will look at it and they will file the ones that say no, and the ones that say yes, they'll pull out and then connect with you around. The second step is the issues summary. So this is a document that collates the issues that are relevant for your team. So no personal information, nothing around reasonable adjustments or flexible working arrangements, nothing personal or sensitive. Just basically a list of the issues that are coming out of your team. So the kind of things that people are asking and mentioning in the chat. So things like, will there be 24-hour access? This is a big issue for my team. Will there be desktop computers available? This is an issue for my team. So those issues is a summary. So as you're doing the one-to-ones, you pull together your issues list, and then that gets sent to the hybrid working project team. So that's why it's important it doesn't have any personal sensitive information on, because the project team has a number of people that access that inbox that are looking at the issues. So that should just be a list of issues. And then step 3, as team managers are completing the one-to-ones, we're asking you to fill out like a planning template. So it's basically got space for you to write all your team members, and then across the top, how many days they want to be based in an office space, how many days they want to be based somewhere else, where would the somewhere else be, would it be at home, would it be in a different office? And that template just gets you to see across all of your team how many desks you're going to need, how many days a week people will be in, that kind of thing. That then you can use for the very last document, which is the SAP planning summary, which is basically a template, a Word document that you type in. This is the name of the team. This is how we're going to be organised. We'll be working across V7 and Goodless Road, and we'll have people in V7 for 5 days a week, and we'll have people in Goodless Road for 2 days a week. People will be working at home. You just kind of describe how your team is going to be working, and like your case, really, the justification for why you can work like that. And those documents get escalated up to the relevant executive director, who will sign them off, who will look at it and go, OK, I get it. I can see the bladder and bowel team are working like this. They're going to be in this space and they'll be using this space. I see it. Yeah, that's fine. I can sign that off. So they are the documents that we need to ask managers to complete. And if you've got any questions about those today, I'm hoping Jason from HR will be joining us shortly, and we can answer any questions around those. So let me finish up. Yeah, I always finish up with this one because I can see we've got lots of questions coming through now. Everybody working on this project recognises that this kind of change impacts on people. You know, it causes a level of anxiety for some people that have to work differently. There's impact on people from a travel perspective, from family caring perspective. You know, we're all different and we all have different lives. And certainly over the last few years, we've all kind of fallen into different ways of working. So it's just to say, you know, we're all doing our best and we're trying to make this as easy and as gentle a process as we can. So just to ask people to bear that in mind, really. We have our trust values and we are a restorative just culture organisation. So we're asking everybody to be treated with respect and support each other as we go through the process. So thank you, Ashley. The last slide, again, you'll have seen this a number of times now, but this is just to give it you, and I'll put the slides in the chat box in a minute so you've got them to hand. You've got the hybrid working inbox address on there where you can inbox any questions that you may have. And also the link at the bottom where it says click here to access this page, that will take you to the SharePoint site on the intranet where everything to do with this project is kept. So the frequently asked questions, the consultation document, the video recordings for the sessions that we've held so far, the slides. Yeah, I think I've listed everything off, but basically that's where you need to go. That's where everything is. So we'll take that down. That's okay, Ashley. And then we can start with the questions because I can see we've got a few in. And then as we're doing those, if people have got, you know, a question that they want to ask, they want to raise their hand and ask that, please do as well. We've got plenty of time. So even if it's just your thoughts, you know, on what you've heard, we can do that as well. So I'm just looking to see if Jason's joined us yet, just in case we've got anything specifically from HR. No, not yet. If we do have anything specifically HR and we can't answer it, we can hold it until Jason jumps on the call. So Tina, I can see you've put your hand up, but let's just do a couple of these in the chat box first, and then we'll come over to you. So we've got a couple, Suzanne. I'm wondering if you can help with these around the hot desks and like the IT and the kit that colleagues will have, particularly colleagues working in 24-hour space, that out of hours space. Is that one you can help with? The first two on the chat bar.
Is that in V7?
So this, I suppose, is it in V7? No, it won't. Well, where are you going, Carol? Where are you? Is it proposed that you go?
Well, we've got 2 satellite offices, Livingston and Lifehouse. But our main base will be in Prescott, out of Liverpool.
Right.
And our laptops often don't work. So in order to fulfill our requirement to document within 24 hours, we have to have somewhere we can document our notes.
Okay.
And God forbid, you know, we've had lovely accommodation that's been open 24 hours. Right. So I'm just wondering what the hours are in Liverpool.
In Prescott.
Well, so we can only go to Prescott, can we?
Oh, no. I'm not answering the questions. I don't know the answer. I can see Alan's got his hand up. Let's go to Alan and then maybe Suzanne around the kit at V7.
Okay.
Yeah, so I'll try and answer both Angela's and Carol's question there. In terms of the IT that's going to be on the desks within the new bases, my understanding is that the preferences for docking stations for laptops. However, there will be desktop computers that are within Babbage House currently, that if we need to put a desktop computer or multiple desktop computers on desks in case of the laptop failures, as Carol suggested, we probably are in a position where we're able to do that. But as part of the move out of Babbage into any of the new bases, Janet Lee's working with Precise Projects, will work with the team leaders to understand what their requirements are going to be, how the new rooms in those buildings need to be set up to best accommodate those teams, so we can pick up the IT requirements as part of that move process. In terms of the out of hours facilities, V7 is going to be a 24/7 building, I understand. But we've also got the likes of Old Swan Walk-in Centre, which will be a 24/7 building where our out of hours district nurses are going to be. And there may well be other locations that have got that availability. I'm not sure what the arrangements is a good list, for instance. But we can certainly look into the availability outside of normal core working. I guess my concern would be about how we manage that at an operational level, that if we have a situation where someone's laptop breaks and they realistically can't write their notes up within that 24-hour period, then is it right that we should be asking staff to travel to an alternative base out of hours, or can we risk assess that, incident report it, and then manage it at the next feasible, appropriate time, rather than asking staff to be travelling because their IT is broken? So I would go back to the service leads operationally to look at those types of challenges, how often it happens, and how we manage that risk.
Okay. Thanks, Alan, and thanks for starting us off there, Carol and Angela. So we've got a couple more that I think might be you, Alan. I'm just looking to see if Michelle Fine's on, or Kathy Baxter, or Kathy Long, because there's one coming up specifically about ICRAS. Oh, Kathy's on, so we can get to that one in a minute, Kathy. I'll give you a warning that we might be coming to you in a sec. Okay, and then we'll bring you in, Tina. So let's do a couple more on the chat, and then we'll go to Tina because she's been waiting patiently. So we've got, let's have a look. We've done Carol and Angela. So Carmen, you're asking about alternatives to accommodation are staff being offered any alternatives to accommodate this change into their personal life other than to just change hours? So the ability to use other bases or to hybrid work. So which service are you in, Carmen? That might help, Alan.
I'm in ICRAS Therapies.
Right, okay. So that's a question, I think, am I right, Alan, that Kathy will need to answer? Yeah,
I mean, I can answer it more generally, I guess. And I think this is, having a quick scan through some of the questions is probably a theme. It's about this availability of other bases outside of V7 or the bases that we've suggested. And I think we need to really look at how we do it in the community division. We've got a huge estate spanning from all the way down in Speak all the way up north to Bootle area for our Liverpool services, and beyond that for colleagues that live up north in Sefton or out in Knowsley area. So we've got a huge estate. And is it right that we should restrict people just to work in specific locations or work from home, if working from home is a particular challenge? And it can be for lots of people. Working from home isn't always useful or possible. So how do we make the most of the other available space, free it up for people to come away from home, don't need to travel all the way to speak, and they can stop somewhere in between to sit at a desk, use a desktop computer, access a printer, that kind of thing? I don't think we've done enough planning in that space, Melissa, just yet. I think it's one back to the project team to say, where would those drop-in stations be? It might not be every location, but there might be a number, 10 locations across the patch where people can call in, know that they can book a desk, know that they can access a desktop computer if there's an IT fault. And I think we need to try and have that conversation before the end of this consultation, or very, very soon after, to make it available.
Yeah. Alan, can I just ask you, sorry, what is the kind of definition of hybrid working within this trust? Because it doesn't, I mean, I might be wrong, but it doesn't feel like it's being supported through our teams. And I know that this is going to be an ongoing discussion and there isn't kind of a yes or no answer, but I was just wondering what the expectations from management is as regards to what hybrid working is and why it's being kind of not promoted.
So it's not a straightforward answer. I know a lady on the call, Melissa Holt, who's just done a huge slide deck which describes the trust's approach to hybrid working, and I know sessions are going to be running on what hybrid working really means. I think there's a simple principle, but then that needs to be understood at a more local level, how that's going to work for you and those services. Melissa, do you want to add anything into that?
Yeah, Carmen, I think it's a really good point. And basically, the final position that the organisation has got to, or let's say the position it's got to for now, is that hybrid working can be offered to anyone where the job allows that work to happen remotely. So, for instance, if your job is a receptionist, obviously you can't be a receptionist if you're not in the building where the reception service is needed. But for many people across the organisation, they can do their job in a different place remotely. So the definition that the organisation has got is, if your job is a job that allows you to do it remotely, then hybrid working could be considered, but it's always got to be around the needs of the service. So for some teams like finance, like my team, for instance, we've been able to work in a hybrid way all through COVID, and now we're carrying on with that. But for other teams, like many of you on call clinical teams, it's not, especially inpatient services, you can't work remotely if you're on an inpatient ward. I know most of you on call are from community services. So it is, Carmen, very much about that specific service and whether the nature of the work can be done in a remote fashion. The organisation is not going to be saying hybrid working means you're on a site 2 days a week or 3 days a week or such a percentage of your time, because the organisation couldn't come up with a figure that would be appropriate for there's 12,000 of us, for every member of staff. So the line that's being taken very much is, it's got to be agreed locally, it's got to be agreed kind of depending on the kind of work you do. Can the work be done effectively from a remote site? And that remote site could be home, it could be another base somewhere else across the Merseycare footprint, like Alan's just been describing. But, going forward, I think there is a commitment from the organisation that where we can, hybrid working is helpful, because it will reduce footfall in buildings when we don't need to have it, which then means, we can make savings on estate, which can be pushed back into services. And where it works for people to be based at home, then let's give people, let's do things that make people's job easier. Let's keep people happy. We don't want to be losing colleagues because the working situation is too difficult for them to bear. So that's why we've got to keep working through this and try and find solutions for everybody. And it may be that on this call we can't, Alan or other senior leadership team members can't give that response, but we've got to keep trying. So I hope that helps, Carmen. So
thank you very much.
I know there's loads coming through in the chat, so Alan, you keep looking at those. I'm going to go to Tina because she's been very patient, and then we'll come back to a question that Michael's asked about. I think it was quite a simple one, Michael, about ICRAS and whether you're in or not. So we'll do that one next. But Tina, let's do you now if we can.
Hi, it's one of my colleagues that's in the office space with me now.
Yeah.
Is going to ask you the question from phlebotomy.
I'm Pauline Durham. What it is on those slides before, you said phlebotomy is going with SPC in Puma. Now we were told a week ago by Nicola that that wasn't happening, so we're a bit confused to where we'll be going.
Okay.
Are we going to Fee 7? We were told we were going to Fee 7.
So it's Pauline, it's a clarifying question, just because you think you've received two different bits of information.
Well, we
so
have
Nicola,
received,
yeah, Nicola is on the call, I think. Nicola, are you there?
Melissa, it's Sue. Nicola's just
hi,
had
Sue.
to jump off. I have just returned from leave, so I'm not fully up to date if anything changed last week, but I'll take that back and I'll link directly in with Tina and the team.
Oh, thanks, Sue. Welcome back from your leave.
Thank you.
Thank you. So Pauline, Sue will get in touch with you about that one. Or if Nicola comes back on call and can answer it, then she can. Any more from you at the moment, Tina?
Yeah, just another one.
Yeah. People are wondering, working from home, are they going to be provided with desks and chairs?
Okay. I can tell you what's happened so far to colleagues working from home, because we went through it all 2 years ago, and yes, we were. People were provided with desks, and we were asked to go into our buildings where we used to be based and get chairs from there. But I don't know, Suzanne, are you able to answer that one in terms of provision of equipment for home working, or Alan, is it an SLT one? Don't know.
My understanding, Melissa, is the same as yours, where equipment has been available within buildings, staff are being allowed to take that as long as we know where it's going, just in case it ever needs to be recalled. Or with I know people have taken desktops home, so if we need to do the PAT testing, we need to know where they are. And I think where there's still gaps, if people are new to hybrid working, maybe join the trust since that has happened, and they need a desk or a chair, we can apply for that through work, is my understanding.
Yeah. Anything to add, Suzanne, to that in terms of the kit people need?
I know it was individuals had to go back to the line managers to discuss this because everyone's different. I know that us in the States we didn't get any equipment or anything like that, but we did have to apply if you needed another monitor to do your work. But it is, I think you do have to take that back to your line manager to discuss, and then they take it further for you.
Yeah, okay, that's helpful, thank you. Okay, Tina, I'm going to move us on. So if you wouldn't mind, if you take your hand down, and then if you've got another question, put it back up, and then I know if it's a new one or not. Right, where did we get up to? Michael, we were coming to you, weren't we? Is that a quick one? Kathy, is Kathy able to answer that one, or you can?
I can answer it, Melissa, yeah. So when we did the initial scoping about how many staff were involved in the move and how many desks we felt we needed, we went out to all of the team leaders and asked them to give us some direction in that respect. So in terms of the ICRAS services as a whole, and looking at the Transfer of Care Hub as well, we accounted for 166 staff, and they needed 54 desks across sites or wherever they're going to be to accommodate this 166 staff. And the slide which I showed before showed that we have 58 desks available across those 3 sites, and that includes the social workers, which I think were destined to go down to Goodless Road as part of the neighbourhood social work team down there.
Does that help, Michael?
Yeah, thanks, Alan. Just for I just needed clarity really, because sometimes we do get missed because we're a bit of an anomaly within the service being social workers, and some people presume that we're LCC staff when we're not. We're actually Mersey Care staff. So just as long as we've been factored into those figures, because we represent anything between 15 and 20 staff members. So it is quite significant if we haven't been factored in regards to places, desk space, and the like.
You're definitely on the presentation that I flashed up before, so I know Kathy's put her hand up since.
And Michael, just before I bring Kathy in, have you been working in a hybrid, you and your colleagues in that team, have you been working in a hybrid way anyway over the last couple of years?
We have, Melissa, quite very successfully. So we currently have 2 days working in LIP a week, but we have, since the pandemic started straight away, we were working from home remotely. So yeah, it's been successful for us.
Yeah. We would never have thought it, would we, that we could work like this? It's been the strangest time. Okay. Kathy, did you want to come in?
Yeah, I was just going to reassure Michael, we have been working with Sue, so we definitely didn't forget you, Michael. How could we? So yeah, we have got desks, and we wanted you to be part of the bigger iCross team, so you are in Goodless Road. So, and Sue is aware of that, and we've been working with her.
Oh, thanks, Kathy. Thank you.
Did you hear that, Michael? How could you be forgotten? Well, it seems you weren't. You weren't forgotten. You weren't. Okay, so there's a couple now, I think, Carol. So one about OT students and having space there. So that might be one that I think probably Alan maybe could pick up. I know John's on the call as well. Is that a quick one?
Yeah.
John,
I mean, we need to look at the requirements for students, absolutely. So there will be the space within Livingston and Lighthouse and Liverpool area, and then there will be the space up in B7 as well for students to accommodate. And of course, we've got the ability to book meeting rooms and book space for other types of meetings. So
yeah. Is it something specific that you were thinking of, Carol, that you wouldn't have space for them? Is it just the numbers of them, or?
Yeah, it's just the practicalities of booking desks, because there's only 10, and I'm conscious we're sharing that with OT. We're 2 big departments, and then with students as well. The student experience is important, really, isn't it? We don't want them to. We need time to go through their assessments, so they need privacy. Also getting there, with them being Liverpool students, often they live around the university or in Wavertree, and that's where we're working in Liverpool. So I think getting to Prescott's probably the only thing they're going to remember about Merseycare. Never want a job again.
No, well, we can't have that, can we then? Okay, so I think it's registered, and I'm looking, John, have you anything to add on that?
No, I would just sort of agree that, as you say, we've got the 3 working examples, and it's whether we can work around those to accommodate the students as best we can.
Yeah.
So, yeah, we haven't a solid answer on it as yet.
No. Okay, so it sounds like it's a work in progress.
We had some great feedback on the last student, and she was saying how good it was that there were other students there. And she was saying what a good potential it would have been for the students to have spent time together, the different disciplines. But this will probably make that even harder.
Yeah.
Unless we can, book space.
I know for sure. I know you're saying that V7 it could cause problems, but there will definitely be meeting space there, and there will be meeting space in other venues. But I think what you're getting at is how do we make sure it's bookable so that you can, when you need to go there, you can access it. I think that's the issue, isn't it?
Yeah.
Yeah. Okay. So Ashley, I know you'll be taking notes, but I think that the whole issue of how we book these desks and we book these hot desk spaces comes up in every session, because nobody wants to drive to a venue, wherever that is, a base, and there not be space available. And it seems the booking bit is really important. So I know, Ashley, you've met, haven't you, with IT about the booking systems?
Yeah, I was just in the middle of typing the answer in, but I'll say it. So yeah, we're currently working with IM, and we're looking at creating a bespoke sort of system that will allow you to book rooms and any hot desks. We don't know how it looks now. It just depends on what individual requirements are and how that's going to work best. But I think we do have a similar system in place now. So we're meeting next week that is. So obviously we'll continue to take everyone's their feedback, like requirements, but we are underway with it, and we think it's the best way. And we're trying to create like a fair sort of process, obviously, to ensure that everyone, you know, has access, and obviously ensuring that the right people have the correct rights as such, so people can't start just removing sort of other people's individual booking, and also create like a reminder as such, because a lot of people will tend to book things and then they forget it, or they no longer require it, and then it's not really fair for other teams who could have had that space as such. So yeah, absolutely. We will keep everyone updated.
So it's on the list, it's being looked at, so that's helpful, thank you. Alan, I think you put your hand up, and then John.
Yeah, all I was going to say was that we've been very, we've asked for the desk space at Livingston Drive and for Lifehouse to be protected for the therapy team, so that won't be hot desking space that's available for anyone to book. It'll be for your teams to utilise. So in terms of, you know, in the example of the students, if we need to ensure that a student has got a desk, then it's back to the team then to agree how they're going to manage that space for the time that the student's on placement, so they get the best experience they can get. That those desks aren't going to be available to other teams to book out. It'll be back to the teams to manage.
Yeah, okay, that's helpful. John, you put your hand up, I think.
Yeah, it was just you were touching on the subject matter there. It was to do with room booking, and it was a bit like in LIP, where, as you say, you had these block bookings which then sometimes got forgot about, or the rooms didn't get used efficiently. So I suppose if the new system had anything in play that would allow, you know, a limited block booking, but which then would free it up for other teams or other staff then to be able to use them effectively, that would be great.
Yeah, good point. Okay, I can see we've got a couple more hands up in the chat and still more questions, but I'm going to come back to you, Tina, because you've been waiting again a little while, and then we'll jump back into the chat box, and then we've got Pam in with a hand up as well.
This question is from Tommy, who works for Health Visiting.
Can I just ask Alan to go back to his slide and to show us how many people or how many desks have been provided for the staff at Goodless Road that are moving over to V7? To clarify.
How many staff?
Sorry?
Sorry, Tom, what was the question? How many desks have been provided at V7?
How many admin staff have desks going to be allocated to them for moving from Goodless Road?
How many desks are there in V7 for those staff moving from Goodless Road? I haven't got that information, Tom. Sorry. I don't know.
No, it doesn't include us on the slide.
I tell a lie. There's a community admin at Babbage that says, is that yourself? No, we haven't got that information, I don't think. Nurse admin, no, that's not yourself. Phlebotomy admin. I don't think we've got the health visitor admin there.
School health.
Or school health.
It's just all the admin really, isn't it?
Okay, so well spotted, Tommy, well spotted. So we need to make sure then, I guess, Alan, that that's picked up with Jan to make sure that those desks have been picked up. That's why these sessions are great, because people see things, you know, that might have been missed, or they have ideas about how things can be done differently. So that's really helpful. Was there anything else, Tina?
No, thanks. That's
okay.
It now.
Okay. So Pam, and then we'll come back to the chat bar.
It's just extending a little bit on what Tommy said. I work for School Health in Goodless. Now, all I've heard in this conversation is the therapies team, the nursing teams, this team. Oh, you'll have fixed desks. Oh, admin. I want to know how you actually think admin work, because we sit at a desk all day. We can't work from laptops. We currently work off two screens. I'm sorry, I mean, I don't mind going to V7, but I want to know when I get there, I've got a seat that I can sit at that's got all the equipment that I'm going to need to perform my job properly. But all I'm hearing is the therapies team, this team, that team. What about admin, who are the core of the work that gets done for all these therapies teams and etc. I just feel like we're getting the rough end of all this. I do, honestly.
Okay, so there's lots of people on the call. That's why it must feel like that. The intention certainly isn't for any team to feel like they're getting the rough end or they're getting left out. There are lots of colleagues I know that need 2 screens for the job. Loads of our finance colleagues, loads of administrators, like admin colleagues in workforce, in HR, in our team, they use 2 screens. So that I don't think is an issue at all, because lots of people have that already. And if you have it already, that will be provided wherever your base is. If that's what you need for your job, then
That's
you'll be
fine.
yeah.
But you've only got us down for 7 desks, and there is 30 admin staff moving over. I personally don't want to work from home because it's not serviceable for me to do it,
Yeah.
because I haven't got a 4-bedroomed house where I can make one an office.
Yeah.
And I just think if I want to go to work to provide the best service that I can give, I want the correct
Absolutely.
thing. You know, you're talking about not upsetting us and stuff, and I vowed I wouldn't say anything, but I'm beginning to feel like we're just an afterthought. I really do feel like that at the moment.
Well, that is honestly not
Because
the
there's not enough
intention.
desks for us. We need desk space.
Yeah.
Hot
Yeah.
desking doesn't work. We moved to Goodless Road and we had the desk operation, desk booking system, and that didn't work. So I know from history, and my colleagues in Goodless Road will tell you the same, it doesn't work. People will just sit down because they can see a desk. There'll be no booking. It's first come, first served. And I just think we need to look at this more thoroughly, to be honest.
Yeah. So I don't know if Nicola's come back on, Sue, but Alan can go first, and then if you can come in, Sue, as well.
Yeah, all I was going to say was that I know the figure 30 was mentioned, and I think that's the total number of staff, but we're not looking to move 30 staff away from Goodless Road to V7. We're looking to create desks that are available at V7 and keep desks at Goodless Road, which are available for the team that need to be there around the teams which they support. And I know we had a conversation about the district nursing teams there who potentially got more desks than they require, which then could be given over towards the admin team to support those nursing teams as well. So we're not looking to move everyone. We're looking to create space across 2 sites. And then whatever IT requirements you require to do your job, we need to make sure that you've still got access to that IT, whichever base you need to work from. Now, some admin team that you may be talking about within your group are able to work from home and happy to work from home. So we'll also support that element of it as well, where it's appropriate to do so. If you can add to that, Sue.
Yeah, thanks, Alan. Just to reassure you, Pam, you know, all the equipment you've got access to now will follow wherever we move to. If working from home is not suitable for you, then we can come up with an arrangement to ensure that you've got an appropriate place to work.
But if there's no desk, so what do you do?
There is enough. There will be enough desks, Pam. So we've been allocated a number of desks, and me and the management team will ensure that there's an appropriate system in place.
Okay, thanks. So it's just that we've been led to believe there's hardly any desks and a number of us going over, so we thought we'd all be sitting on each other's knees, which would have been a good day. Thanks a lot.
No, don't worry, Pam.
Thank you.
I think, but the thing is, what Pam's raising is really important. This cannot be and has never been about making people's daily work impossible or difficult, because that isn't in the interest of anybody here. That, you know, we've all got to be able to do our job to the very best of our ability when we come into work. So if anybody's feeling like this is going to impact on them, then you're doing the right thing by raising it, Pam. You know, and you won't be the only one that's feeling it. So, you know, thank you for your honesty, really. And for doing that. Okay, let's keep going, folks, because we've got loads of questions now in the chat box. So I think we're up to Janice, who asked it ages ago about hybrid working, and I'm not quite sure if I've got the gist of your question, Janice, because I think you're saying, how can this not be replicated? Do you mean, why can this not be replicated? Are you there, Janice?
Sorry, I was just unmuting. there just seems to be a lack of clarity in our team about whether we are, or following on what Carmen said, whether we are or are not allowed to hybrid work.
Right. Okay.
I don't feel that that's really been explained to our team personally. There's been a lot of different discussions, so we kind of don't know where we're at.
Okay. So just remind me, Janice, which team you're in?
We're the ICRAS therapy team.
Yeah. So
we did hybrid work in the pandemic, and it worked really well. And that's sort of been abandoned now, and we've got to show face every day in the office.
So
yeah.
Kathy, is it Kathy Allen that would answer that, or is it? Help me out. I don't know who would be the best person to respond to Janice's query.
I can answer it, Melissa. We did do hybrid working through the pandemic, and we have reviewed how it went, what worked well and what didn't work well. And obviously we are an urgent reactive service, and we can't do that if we don't know what our capacity is. So if we've got staff at home, what we're relying on is our coordinators who get inundated is to then start ringing around everybody's phones to see if anybody's available to go out. So we're more than happy to meet with therapies to discuss what went well, what we found that didn't go so well, and why we need to do this. We're picking up extra work. We're starting to work with NWAS around the 2-hour response. We're also obviously in a difficult position with Luft, that we will be picking more patients up. So it's using the capacity we've got wisely rather than ringing around people, and we feel that that's not appropriate. We're happy for agile working if you start your day at home and then you go to your patients, but we have to see what capacity we've got when they finish with those patients, so that we can use that capacity when it's needed.
Thank you for explaining, that's great, but we weren't told that we could agile work. We were told that wasn't allowed to start from home.
Well, I believe, Janice, that there's a rota, so I'm not sure why there's not a rota in Liverpool. There's definitely a rota in Sefton where people start the day in the office, and there's days where they start the day at home, and that we don't see an issue with that. What we do see an issue with is if we don't see people in the office, because we don't know how long your calls will take. You don't know how long that the calls will take, because these patients are, they're not planned therapy calls. These are patients that potentially you'll go in and you could be there for 2 hours with them. You could go in and you're there 5 minutes. So we've got to use our capacity wisely, bearing in mind that the condition that the system is in currently. So yeah, there will be a rota of who will start the day at home, but it's not that we want you to come in and see your face. Absolutely not. It's because we know that the challenge that we've got ahead, looking to support Luft to close those beds, and coming into a winter that's going to be really difficult. What we don't want is in winter we then change the way we work again, because we can't have hybrid working because we're just inundated. So we want to plan and make sure that it's as safe as possible now, and that staff are supported going into a really difficult winter.
Okay, thanks for explaining. I just feel like what Carmen said before, and all of our team aren't really all that really sure what the different ways of working are and how they can work for us. So going forward, it would be good to sort of sit down and talk about that.
Yeah, I just think that people get mixed up with hybrid and agile working, and we are happy for agile working to start your day at home, definitely. And that there would be a rota for that. And we want your comments. We want you to tell us how it works, Janice, because we've put in the waiting tool, and I've seen a question off Rowena Cherry, about medicines and coming from Speak. We've put the waiting tool in, and there's plans to put a waiting tool in for therapies as well, to make sure that we do use that capacity wisely. But that's not set in stone. If things aren't working, then we've obviously got to sit down and look at what, do we need to make changes to that waiting tool now that we're further out. That's always going to be on the table.
Okay. Thanks, Kathy. And I think you picked up that question as well in the chat bar, didn't you? So that's helpful. Okay, let's keep going with the questions then. So I'm There's loads. I've gone to the bottom and now I'm having to go all the way back up to the top. So Carol, we've done the students one, we've done the one from Janice. Kathy, the one from Victoria about why are ICRAS therapies and ICRAS nurses being separated, is that one that you could comment on as well?
Sorry, Melissa, I was on my phone. What was the question? Sorry. From
Victoria Evans, why are ICRAS therapies and ICRAS nurses being separated? How will we work co-productively to ensure first-class patient care?
To be honest, Melissa, I think the integration of therapies and nurses has been a bit difficult anyway. But as far as I'm aware, they will all be based up at Goodless Road, certainly for Central and South. That is the plan. So, and going forward, there will be more integrated work and around obviously calls and rehab of patients. So that's something that we are definitely looking at. But yeah. I don't know where that would come from, that we were going to separate them, because I think Alan's aware that we wanted them all based in the same place for that very reason.
Yeah, were you going to come in, Alan? You're just putting your thumbs up.
Yeah, sorry, I started to try and reply to some of these messages, but all the replies go right to the bottom of the chat bar, so you can't see them. Exactly what Kathy said. I think the idea is to cohort the ICRAS teams, neighbourhood teams, social workers together in Goodless Road so they can continue to work together.
Okay. Is that okay, Victoria?
Thank.
Okay. Michael, have you just put your hand up in response to that? Did you want to jump in there?
Thanks, Melissa. Alan, can you clarify if the CHC team will be at Goodless Park as well? Because I know that in the previous slide they were V7.
V7 still. This is what is my best understanding, Michael.
Because we work closely with them in regards to the 28-day pathway. So, I mean, in regards to like working together, it would be more appropriate, I would feel, if they were with the ICRAS team rather than separated.
Yeah, I think the understanding from the CHC team was that they do a lot of hybrid virtual working anyway. They're moving around, whether it's to a care home or to bases. So it felt that a move to V7 probably wouldn't affect them too much. It would give them some opportunity to base themselves in the V7, but still work in that hybrid way in and around Liverpool as well, which may include going into Goodless Road and booking space to be alongside their teams, whether it's just for a one-to-one or for a meeting. So I think that was the understanding around CHC.
You know, when you hear people talking about it, what we need really is like one massive building, which I suppose is what you have when you're working in an acute hospital. But if Merseycare were to have one massive building where everybody was, where would you put it? Because our services are like so huge and they cover such a massive geography. You're just never going to find a perfect fit for it, are you?
The problem there, Melissa, as well, that you'd have that one building and the majority of the time it'd be empty, because we're community services and we're out seeing patients. So that's part of the challenge as well.
Yeah. Okay, so let's keep going then. And I know colleagues are picking questions off as well. So there's a question from Angela about staff and the admin hub. Sue, can you answer that one from Angela Bowen? Where services have specific service administrators, will these staff be sat with the team or in the admin hub?
So there's a few teams, Melissa, where such as CYP and LIP, they will be going over to B7, but the staff aligned to AHPs and specialist services, they will be remaining with the team. That's my understanding.
Right. Okay.
Yeah.
And you know, folks, great that you're asking these questions now, but if you get an answer and it doesn't make sense, or you know, you're not getting the clarity that you need, go back and speak to your managers. And I know lots of managers are on call, but you know, this is exactly the content that should be going into the one-to-ones, where if you asking a question, how is this going to work for me? How is it going to work? Will I be sat with our team? They're the questions that you should be bringing up in your one-to-one, so that they can be escalated or they can be resolved, you know. So yeah, just encouraging you to do that really. So Nora, you've asked a question about mileage, and I think there's a couple of others around mileage and expenses and things. So I'm just looking to see if Jason has jumped on yet. Jason, are you with us yet? He must be held up. So I can give it a go, folks, and answer what I've heard HR colleagues share on other calls. So basically, if the office move that's being proposed for you means that your starting point for the beginning of your day when you're going into a base is further from your home than it is now, you will get protected for 4 years, the expense of that. Okay, so that covers people that are having to travel further to get to their base. That's what HR colleagues have been sharing on this call. Other questions that are on here around, will we get expenses for working from home? No, we won't. So that the thinking behind that, and execs have been really clear on this, is not everybody can work from home. Not everybody has that opportunity to work from home. So what you'd be doing is you would be creating an organisation where some people can work from home and get money towards fuel and towards bills and all the rest of it. And some people who can't work from home don't get any of that. What we've got to do is make sure that if you can't work from home for whatever reason, there is a space for you to go into. And that's what we're trying to do here. Nobody's being forced to work from home. None of us are going to be home workers, and none of us will be given recompense for being at home. But like for me, on the days that I work from home, I'm saving the money that I would be using to drive into a base. So that money that would be putting petrol in my car is going on my fuel bills. And that's the way that on my heating bills or whatever, that's the way that execs have kind of explained this. So, and that those questions about mileage and about bills and funding, all of those are in those 93 frequently asked questions. So please do have a look at them if you haven't already seen them, because I think to some of these questions you'll get that response, you'll see it written down, just in case I haven't explained it well enough.
Will it have to be added automatically, or would we have to add it onto the mileages?
Oh, I don't know.
Would it be done automatically, or are we going to have to add it each day or each month or whatever?
I don't know. I'm really sorry. We'll put it on the FAQs, and it can be added to the question that's on there about how the mechanics of how it will actually happen, because I don't know.
Yeah, because I don't know whether we add it each day as you come into the office, or and then add to the new base, or put it down like we're in Lip at the moment and we're going to Queen's Drive. Do we add from Lip to Queen's Drive, or and then Queen's Drive to Lip, or I don't know.
Or straight from your home. I don't know either. But Ashley, can you make a note, and then that bit of the question, how will this work? How practically do we do this? Can be added to the frequently asked question about expenses, can't it? It would fit in there.
Okay.
Sorry, Nora. I wouldn't even begin to try and answer that one. Okay, problem. So Malgorzata, you've had your hand up for a little while, and then we'll come back to the chat bar.
Yeah, I just want to clarify, because you said obviously if you're working from home, then you are not using the money to travel to work. I actually, when I travel to my first patient, I'm not paid for that, because obviously I'm working from home. So then this is treated, as I understand correctly, as my base. So I'm not sure. As long as I could see on my expenses, I'm normally paid for traveling from my first patient to my second patient, but I never get paid for traveling to my first patient. So I think a few of my colleagues as well try to find it out as well, if it's possible to clarify about our starting base as well, because we're actually losing on our expenses for traveling.
And it's come up a lot on these calls, and actually I'm going to ask Marg Dowd to come in because she explains it really well. Marg, if you can. But just to say, the question that you're asking is relevant because it's connected with what we're talking about, but it isn't just specific to colleagues that are involved in this consultation. It's for everybody that's working in this kind of community way. So we can answer it as part of today's conversation, but it's not just you that this affects, it affects everybody that works for Merseycare, whether they're involved in this consultation or not. I'm right, aren't I, Marg? See, I was listening.
Yeah, I think it's a difficult one to try and comprehend, really, to be honest, Melissa. I think you have to join two of the questions together, because I think if you move base, then you know you are protected for 4 years for that move from base. Yeah. So when you're doing from your home to your first patient, if that is nearer than you move to your base, then that expense is already covered in your pay protection.
Yeah.
Are you with me? And then you would get paid from the first patient to the second patient, etc., etc.
Yeah.
That makes sense?
It's an anomaly, isn't it? And lots of people have brought it up.
Yeah.
Can I just clarify one thing? So obviously, if I'm traveling during the day just to one patient, and obviously, let's just agree it's closer to my from my home to see that patient, I'm still using my private car. And if I'm not paid for that, and there were enters on the car as well, and we don't have any excess pay on the top of it for using our private cars as well. So, because, you know, we could travel, for example, just to one patient, and if we are not paid for that and we are using our private cars, that's not really fair to us, isn't it?
But I suppose what it is you would normally travel from your home to your base, and you wouldn't be paid for that travel from your home to your base.
Yeah.
So if your home to your first patient is nearer, then that's covered in the costs that you wouldn't get in terms of being paid from your home to your base.
Yeah, I think so. I don't want us to go down.
Question.
No, I don't want to go down a rabbit hole on it, because we've got lots of other questions, but Bethan has kind of answered it in the chat box as well. Thanks, Bethan. That's helpful. So Margazetta, if it's still an issue and it sounds like it's something that you want to raise, make sure that it gets logged on the issue sheet in your one-to-one.
Melissa, I do think we need to put an extensive answer to that question, because as you rightly say, it comes up so many times. We do need to put an extensive answer to that question in the FAQs, just so that we do well and truly answer that for all our colleagues that are concerned. And it's probably Jason that could provide you with that extensive answer to that one.
So we'll make a note, Ashley, that's one that we would like HR to kind of add more to try and explain it a bit more. That's helpful. Thanks, Marg. So who's just popped the hands up? Let's have a look, and then we'll keep coming back to the chat. Kieran, hi, Kieran.
Sue Evans, are you right? So it's just a quick one. Specialist services are now split, and we did work together, and we're not going to have all admin staff. Will there be a rota of admin staff coming into our bases then? Because I know, like, Connor, he works for skin and palliative care. So if we're not sitting together, how is that going to work?
More than likely, Kieran. We haven't sort of got that far down to the planning yet, but we'll ensure there's appropriate support. It'll be a similar setup now, because the staff are already hybrid working.
Yeah.
Over the two teams, so it'll be a similar setup. But yeah, we'll get into the detail.
Yeah, that's fine. Thank you.
Thanks, Kieran.
Okay, thank you, Kieran and Sue, and then John.
It was just going back to the expenses. I think staff really found it useful in the past to have working examples on the scenarios, and that sort of helped explain things a wee bit better, if that could be done. But thank you.
So Ashley, we make a note that it would be good to have a working example of it, so that like you're saying, John, it kind of talks it through. Okay, goodo. Right, Angela Bowen put a question way back at 1:20. Are there any hot desk spots that are available for use in North Liverpool? Alan, is that one that you can answer?
Yeah, I think I answered it earlier. We need to look at it as part of the project team. I think it would be an absolute benefit to a lot of people if there was an alternative to travelling to the other side of Liverpool to get to their base if they can't work from home. So we'll pick that up in the project group as well.
Yeah, okay, that's helpful. And then Cherry, you'd said about the drive times and going backwards and forwards. So I think again, raise it as an issue in a one-to-one, and then does it have to be to Goodless Road that you go to? Is there anywhere else? So I think all of those very specific ones, and your poor arthritic ankles, I do feel for you because there are a lot of stairs in Goodless Road, but there are lifts. Or were you meaning just generally travelling? But yeah, I've got your comment there. Okay, Angela also asked, where services have specific, we've done that one. Nora, I think we've done that one on mileage. I think Janice, we've had an answer to that. Carmen, I think we've had an answer to that. Cherry, we've had that one. I'm going down the list. Suzanne, will the admin for specialist nurses, bladder, bowel, skin, PAL, etc. be seated with the nursing team, or will all be separated and go to V7? Sue, is that one for you? Can you answer that?
Yeah, we've answered that back in the
okay.
comments box.
Okay, yeah. Sorry, I'm a bit behind then on them. Amanda, I think we've answered that one. People who don't drive, and the move means 2 buses. If needing to go in, can we work from our nearest base? I think the answer is discuss it with your line manager, see if that can be worked through. If it makes sense, let's explore it. Where are we up to, Alan? Any that I'm missing here?
I was just reading Carol's point there around making sure that we're delivering, well, it says we could be delivering unsafe services if the views on the moves aren't taken seriously. Absolutely, and that's the whole point of the one-to-ones and the consultation. They remain proposals at the moment, so we need to understand the challenges against those proposals, the issues that those proposals will create, and look for alternatives, find the right ways of operationalizing our services in those new bases and keeping patients safe. So I mean, a lot of this, I've already had conversations with John around what John can do at a team lead level to support community physio if these proposals go ahead, to ensure that we deliver safe services. And if we absolutely can't, if there's risk there, we need to identify it and discuss it.
Yeah.
I think it's practical things like perhaps having desks free for day texes, time allocated for really, really traumatic visits, especially with part-time staff, you know, and time allocated for new staff, band 5s for supervision. I realise for staff that have been working in the service a long time, you know, you may not have quite the same concerns, but we're really keen to welcome new staff to the service. So we just have to have systems in place, don't we, to support them, and perhaps develop a ratio of when you're new, how much time you spend in the office, how much time you spend at home, you know, and make sure there's desk space for traumatic, you know.
Yeah, absolutely. And it goes into Ronan's comments as well around the need for flexibility and the change of patient circumstances, staff circumstances. It's really back to the team, and we've said this, Melissa, several times over. You guys know how to deliver your services far better than Melissa or I or the project team. So if the estates go ahead as proposed, how are your teams able to operate in the way you need to within those bases? And if it's not going to be feasible, if it's not going to be possible, that's what we need to flag back up to the project team, so that they're fully aware that we're creating a risk if we go ahead with these plans.
Yeah.
So a lot of the conversation needs to take place with, you know, Ronan, Carol, John, Bernie from the OT department, and understand how we can work in these circumstances.
I completely get what you're saying, Carol, and I think when you start in a new organisation, and some of you maybe did start through COVID, you know, it can be lonely, can't it? And when you're learning a new role, it can be a lonely place. And we know that people feel more attached and more connected when they're with other human beings. So certainly in teams like mine, I had people start during COVID that I'd never met. And they did their job, and I've never physically been in a room with them. And I know for clinical colleagues that's different, and I know you do spend more time together, but we do have to remember that when people are new, when they've changed roles, they need more support. And I think this new way of working, like moving into this hybrid space when we can, we've got to really attend to that and make sure that we, like you said, we build time in for it. It won't just happen by chance like it might have done in the past, you know, where you're just in at the same time and you're having a corridor conversation. Those things won't happen. We have to be purposeful about attending to those times. And we're running some sessions through August. I know it's not ideal because it's over the summer, but there's 4 dates we've put in that go through, like, it's a little bit of a pilot really on a session that looks at how do we work in a hybrid way? What are the things we should be thinking about? And if you're a manager, how do I manage a team in a hybrid way? So have a look at those and come along if you think it would be helpful. Give us some feedback on them as well.
Okay, I'll try to. Thank you.
Yeah, do. Okay, we've got 10 minutes. Gosh, I thought we'd have loads of time, you know. I thought we'd, you know, I didn't think we'd fill it, but look, loads of questions. So, a couple there, Pam, comment about laptops. So I'm going to hope that Sue can pick that up in terms of equipment. Rosalind, has anybody answered your question, Rosalind? How will we ensure no loss of clinical time while we are having to drive to V7 for collection of equipment? If we were to keep equipment at 3 possible bases, we'll have the knock-on effect of making it. Okay. So is that about storage and equipment being close to where you need it? I think that's what the gist of that is from Rosalind.
Yeah, I think sort of productivity wise, it was having quick and easy access to.
Yeah, so we are looking to create satellite stores at each of the 3 sites that therapy's been moving to. And I know losing stock can be an issue. I think we can take that risk if it's going to save staff time and staff expense for travelling 17 miles, as Rosalind said, to and from V7. I'd prefer to lose a little bit on lost stock and take that risk than have staff moving up and down the motorway all day.
Yeah. Okay. But all dead practical stuff. So just a very quick one then from, and then we'll go to whoever's got the hand up. I just saw a very quick question there and I thought, oh, that'll be a quick one to answer. Where was it? Parking. There we go. That was it. Is the parking at Puma Court? Yes, there is parking at Puma Court, but we chatted about this yesterday on another session. It's not a problem now because people are working differently, aren't they? And during COVID, parking hasn't been a problem anywhere really. So if Puma Court car park is full, because I don't think it's a huge car park, then the V7 car park a few doors down is where we're saying people can park, and it's going to be monitored because as soon as people start using V7 again and colleagues move from Babbage House to V7, that might impact on the parking situation. So the project team know it's something that they need to keep their eye on in terms of making sure that parking is covered off. So that was Stephen's question there. So in the hands up, Donna, you've again been waiting patiently. Thank you.
Can I just ask Melissa, so can we choose not to agile work, hybrid work? Can I choose to just go to the base every day? An allocated base?
Well, some people really can't work from home. You know, it makes them unwell to be isolated in that way, and it's come up on other calls as well. And I think the message that our HR colleagues have been given is nobody's being forced to work in any way, because you know, if as human beings we're forced to do something and it's unbearable, we'll just leave. You know, if I was forced to work in a way that I couldn't, I'd just leave Merseycare. And we just do not want this to be something that causes people to go elsewhere. So I think the message would be, have the conversation with your manager. If for you individually, it's about being in an office 5 days a week and that's what you need, then let's see if that can't be accommodated. If everybody wants to be in an office 5 days a week, then that's a different story, isn't it? But even just on this call, there are people that absolutely won't want to be in an office 5 days a week. There are some people that don't want to come in ever again. So it's very much about having the conversation with your manager to work it through what it would look like for your team, which is that team planning template I mentioned. And I know somebody said it's not practical for community services. And it may not be, but you know, if somebody came to you and said, how many days a week do you want to be in the office? You might say 5. and then the next person in the team would go none. And just having that conversation means that managers can get a sense of where are people standing on this. And let's try and do it so that everybody gets what they need. I don't know which team you're in, so I don't know if your manager's on call to answer. Which team are you, Donna?
I'm in the community physio, but I'm just thinking from a point of view, you know, you're talking about things like we won't get overheads at home, we're not getting the mileage from home. I understand what they're explaining about mileage, but it's kind of like, are we being given a choice of base, or are we being pushed into this agile working, and then it's not being acknowledged that that is our base?
Yeah.
And that's kind of where I'm coming from with this. So it could be that I choose not to agile work because actually it's more cost effective for me to actually go into work and be at a base.
Yeah.
And can you accommodate that?
Yeah, I think generally the answer is yes. You know, most people will be accommodated, but like I said before, if everybody in your team wanted to be 5 days a week in, then that would be difficult. But we've heard on this call already, haven't we? There are other colleagues that go, we want to work hybrid, we don't want to go into an office. So is your manager on the call, Donna?
Yes, John has spoken to me. Yes, he's quite open with everything. So yes.
The short answer is no, nobody's being forced to work from home. No, we're not having home worker contracts. Nobody's being a home worker. We all still need a base. The extent to how often we're in that base is for local agreement, for discussion with our managers and based on what our service needs.
Okay, thank you.
Okay, anybody else with the hand up, or do we go? Oh, Jane, are you getting quick, Jane?
Yeah, hi, I'm Jane. I work for Community Physio. John's my team lead. My concerns are, I mean, Pam just blown that question. I was just so made up she said that, and I really do feel for the admin because they are our support. They are our lifeline. You know, they're at the end of the phone call. You can go into that office, they'll find something for you, everything, you know what I mean? I mean, I'm not IT tech, you know what I mean? And I hate working. I'm sitting on my mobile because I couldn't get my laptop up. I'm sitting in a car park. You know, you know, I would have run into Lip if it had been there, if you know, where we were, Livingston Drive. I can't get into Livingston Drive because I haven't got a fob at the moment. Do you see what I mean? But anyway, my question was, we've had 4 moves over the last couple of years, and the amount of energy, emotional energy as well, expense, you know, I can't tell you what it's been like for the team leads, Marg and John, and for the staff. But you know, how can you guarantee that this is not going to happen a year down the line, another year down the line? You know, you can't. We're a community service who, yes, we work in the community, but we need a base to go to. I'm not sure whether HR or admin, some of these staff, you're dealing with people who could come out with anything, you know, and once they say to you, well, I'd like to tell you something, you're thinking of a datex, you're thinking of all that time, that phone call. I remember once, a couple of months ago, a patient tried to keep me in the house. He was throwing me out the house, but then he decided he wanted to keep me in the house, and all that for my supervisor, with the time, energy it took, and that was like 3:30 in the afternoon. That went on for nearly a day. You know, you can't account for these times, and these happen all the time. You guys aren't aware of what happens there, but not just for community, you know, therapies. I'm talking about district nurses, bladder and bowel, everything, the services that we provide. We are community. Yes, we work there, but we need a good base to go to pick up that equipment, to go, like, let's go and do it now. I've been to stores today because I was in L9, but I've picked this equipment up rather than going back to Lip to go and borrow it.
Yeah.
You know, you know, Alan, you've got to get with this. You know what I mean? You're going to lose your staff. You've already lost, you know, my own son works at the service and he's left. And he's happy as Larry working where he is because he didn't want to work there, where he just come in now and again, hi, and all that. He wants to work with team. He's young. You know, and so he should be, because it's a social aspect as well. And from also a point of view of, you don't know what people are sitting on at home. I don't know what you're all sitting on, but most people won't be sitting on having a good posture or anything like that, and you're going to have all these problems. So, you know, you talk about moving and handling in for the nurses, for the beds, and how we're handling our patients, but how we're handling ourselves at home. So there was another question I wanted to ask as well, is that somebody said, do we need to be coming into the office? Yes, we do. For my sake, for my patient's sake, and I might make a difference for my team colleague as well. And I've been in this morning into LIP. We had a safety huddle, and we had invaluable bite-sized training, which for me is, you know, it was invaluable. Doing it over Teams is no good for me. You know what I mean? You may as well talk to the wall. But I love my team, and I know my team are a good team, and you're dissecting them and not just my team, other teams, and it's not going to work. We are a community team who need community bases. And whether it be an hour a day, that's up to, you know, how we think it, but we're there. Yeah. And we know that somebody will be there. We have an office person. I'm saying this from the heart now, because I feel like I'm saying every time we have this meeting, we have a person that we can phone, and we know it's down the line. You know, it's so good to have that, but face to face, you can't beat it. Yeah. No, and I think
there's lots of people on the call, Jane, that will be agreeing and nodding and agreeing with you. I get that. I'm just looking at the time because we'll finish. Yeah, but I'm just going to say, but there are also people on the call saying, I don't want to go into an office, and we're saying, well, you do have to come in sometimes. So you can see the balance. You can see your view is at one end of a spectrum, and then there are colleagues on this call that are at completely the other end going, I don't see why I ever have to go in. So this is all just a massive balancing out, but there will be a way of us finding a way. For everybody on call, there'll be a way of working it out.
Melissa,
we've just got to keep going.
Because that's what we are. We are services that work well within the team, and that's based on what we all know what each other can bring to the team. And you're going to lose that with new starters. Because you won't know, they won't understand, you know, it's anyway. But just I'd like to know if there was any plans on another move. That would be my biggest concern. If there's
Can you answer that one quickly, Alan, and then we'll wrap up?
Quick one. I could say that there are no plans on another move, but that's not to say that there won't be plans tomorrow. We're a service that are going through massive organisational change at the moment. We're taking 4 divisions and moving it into 3. We're putting a whole new management and leadership structure and clinical leadership structure in, which will start to develop a strategy about how community services will need to be delivered in the next couple of years, but longer term. And our estates needs will need to be part of that strategy. So they are likely to change. When they change, I don't know. We have leases on buildings that will come to an end, and decisions will need to be made, whether it's right to renew them or whether we need to look for something different. So I absolutely appreciate that community physio and probably others on the call have moved several times in the last couple of years, and it does feel like a waste of people's time and money to keep these moves happening. But I couldn't sit here now and say that we're not going to be asking teams to move again in the future, and I wouldn't know how long away that is. Just on another point that Jane picked up there, I think you're right, Melissa. It swings around about people are going to benefit from it, some people aren't. It's essential that we get the safety aspects right and we manage risks around all of this. But my biggest issue is the recruitment and the retention. How do we attract people to the organisation if they haven't got that feeling of being part of the team and they haven't got that support around them? And especially at this point in time where the Royal Liverpool's opening its new hospital, you know, all singing, all dancing, fine, and you know, all new, clean, lovely, and they're recruiting people to be part of the team at the new Royal Liverpool. And I worry that if we're asking people to spend more time away from their colleagues, more time working from home, then they might just say, and especially the younger groups and fresh out of university and wanting that social aspect, they might just say, we'll go and work for the Royal instead. They might get for them a better experience than Merseycare can offer, and that for me is one of the biggest issues that we've got around hybrid working and these changes that we're making now.
Yeah. Okay, folks, thank you so much. You know, always really good that we have this level of conversation and your questions. Please do have your one-to-ones if you haven't already, and feed in those concerns, you know, like Jane, I'm sure you already have, but just make sure that, you know, you've spoken to your manager, it's on your one-to-one form. Any issues that can't be resolved locally are escalated up. The consultation, as I said, is open till the 12th, so still got a few weeks, and then we've got a number of sessions that are happening then towards the end of August, which you'll see you'll see them as consultation close down sessions. So I've just scribbled them down out of my diary, so I hope these have been cascaded to you already. If not, have a look at the dates through the SharePoint side. There's a list where it says consultation sessions. There's all the dates there and the Teams links there. So the 25th of August is the session for COTAR and therapies colleagues. The session on the 30th is for ICRAS and associated teams, and then the session on the 31st is for kind of nursing and nursing admin support. So if you have a look on the SharePoint site, you'll see the table with all the closed down sessions listed, and there's more detail on in terms of the teams. And it's important, if you can, that you get to the one that's connected to your service, because at that session the service managers will be saying to you, right, this is what we propose, this is what we've heard, this is what we've now done, this is what we're going to be implementing. So if you go to a session and you're in the wrong one, they'll be talking about a team that isn't your team, so you need to get to the team the session connected to your team, if you know what I mean. Okay, Alan, and then we'll finish.
Yeah, I was going to say there's still loads of questions that we haven't got to today, and some of them are probably within the FAQs already, but I guess I'm not looking for Ashley's help that we can pick out the other questions that haven't been asked before and include them in the FAQs. There was one that Cherry asked around medication times, which I don't think I've seen come up before now.
Okay.
So I want to really make sure that's a good clinical question that we really do need to answer. So hopefully we'll get all them picked out and into the FAQs to get that updated.
Okay, fabulous, thank you. Thank you all so much, folks. Sorry we've gone over about a few minutes. There was lots of conversation there. Enjoy the rest of your day and the rest of the week, and see you soon. Thanks all.
Thanks everyone.
Bye bye.
Bye.